Hi, my name's Dr Marcus Spry. I'm a dentist in the United Kingdom. Welcome to my channel. Hi, today we're going to talk about TMJ problems, which is the name of the joint. It's called the temporomandibular joint, TMJ, and joint pain. It's really very distressing if you or a loved one gets this particular problem, that they can be in quite a lot of trouble and they can have limitation to the amount they can open, and they're pretty miserable. So what is it and what to do and what's the long-term kind of treatments? I think the basic way of looking at it is you can sprain your jaw joint just the same as you can sprain any joint. If you overwork your knee or your ankle, if you turn your ankle, if you're walking along and you move it awkwardly, then you can tear the muscles and get in some pain and spasm, and that's what you can do to your jaw joint. You might think, well, when on earth would I do that? It's not like the jaw is particularly that loaded with pressure. But what we found happens by some very detailed experiments that have been done is that we spend about a quarter or maybe even a half of our sleeping time with our teeth together, or actually grinding and moving them. So it's nighttime grinding and clenching that can cause the load problem on the jaw joint. I don't know if you've ever woken up in the morning with a headache and think, well, I didn't drink too much, it's not a hangover, so what on earth's happening? And it may be because you've been clenching or grinding your teeth in your sleep, and that has produced the headache. So that is the cause of it. Sometimes it can also be because your teeth don't fit together very well. So obviously a visit to the dentist and analysis of that would be useful. But what you can have done is that you can have a bite guard made. I'll put one here. And this bite guard fits over the teeth, and because it's slightly spongy in its consistency, it will absorb the pressure of you biting in your sleep, so that you don't then overwork your jaw joint and produce these painful symptoms and maybe even a little bit of difficulty with the opening. So the first thing to do is to go to see a dentist, have your bite and your teeth looked at, and if a diagnosis of TMJ dysfunction is made, then the dentist may well make you one of these little rubbery bite guards that fit over the teeth. But in the meantime, what you can do is that you can apply some hot and cold to the jaw joint, and the easiest way of doing that is to have a hot water bottle and put it in its cover, or a towel, and then put it on for 5 minutes, and then get a bag of peas, frozen peas or corn or whatever you have at home, an old bag perhaps from the freezer, and then put cold on, and then swap over after 5 minutes to the hot, and then swap over into the cold. And it's a kind of sports therapy sort of treatment, where this alternation between hot and cold will free off the jaw joint a little bit. Okay, so 5 minutes of hot, 5 minutes of cold, 5 minutes of hot, 5 minutes of cold, and that will tend to start to free the jaw joint off. You can also take some pain relief. You can take some, if you're able to, and there's no clashes with any other medication that you take or allergies, and you can take some paracetamol, or you can take some ibuprofen, some Nurofen in the UK, and that will tend to help it ease off as well. Alright, so hot and cold and painkillers, plus then of course you'd want to go on a fairly soft diet. So I'm afraid for a few days you might be on the soup, and you might be on the yogurt, and things that aren't going to be difficult to eat and easy to feed in. And then the combination of the painkillers, the hot and the cold, and the soft diet should free the jaw joint off, and then you should be able to go to your dentist and have the impression taken to make the bite guard, which hopefully should prevent the problem coming back in the future. So I hope that's been of help to you. Great, thanks very much for watching. Remember, I put a video up every week, so like, share and subscribe for a smile for life.